This segment on when to call the pediatrician is brought to you by Pedialyte. Stock your medicine cabinet today with the #1 pediatrician recommended brand for preventing dehydration due to diarrhea and vomiting. Be prepared with Pedialyte.
When your baby gets sick, it's hard to figure out what's wrong. After all, your baby can't tell you when something hurts. So how do you know if you should take your baby to the doctor or seek emergency care?
First of all, if you think your baby's sick, I want to hear from you, because I'd much rather sell reassurance than antibiotics or medication.
The time to call your doctor is if you're concerned about your baby's excessive crying, or if your baby isn't eating well, sleeping, or not behaving like usual. Here are some symptoms to watch out for. Changes in appetite. If your baby doesn't want to eat after several attempts, or doesn't eat as much as usual. Changes in mood. If your baby is lethargic or difficult to rouse, irritable, and crying inconsolably. Changes in skin color. If your baby's skin becomes yellowish or you notice a paleness to your baby's skin.
A child in the first month may be pretty sick and not run a fever. And all you may notice is just, he's not feeding very well, his color doesn't look very good, there's just something about my baby that's different. And that's that maternal instinct that I want you to key in on.
Fever. A mild fever in a child 4 to 6 months is common and usually harmless.
People oftentimes are concerned the baby's temperature is 99.6 or 99.8. Well, temperatures fluctuate throughout the day. They're not just a static 98.6 all the time.
If your baby is younger than 2 months old and has a rectal temperature of 100.4 degrees or higher, or if your older infant has an oral or ear temperature of 101 degrees or higher, you need to contact your doctor.
Certainly, any temperature of that degree in the first month to 6 weeks of life is a definite red flag, and that baby needs to be seen.
You can take a temperature in the mouth, in the bottom, under the arm, in the ear, and even on the forehead. To take it under the arm, hold the thermometer snugly in the armpit. Hold your arm down until the thermometer beeps. Then remove and read it. Digital ear thermometers are also a quick, safe method of taking a child's temperature. Gently insert the tip into your child's ear, activate, and read the temperature from the display. To take it rectally, lubricate the tip of the thermometer with petroleum jelly. Lay your child face down across your lap. Insert the thermometer no more than an inch into his bottom. Hold the thermometer in place until you hear the beeping sound. Keep in mind, a newborn's temperature will naturally fluctuate about 1 degree throughout the day. Other symptoms to watch out for: vomiting. If your baby begins to spit up large amounts after every feeding or vomits forcefully, that's not normal. Diarrhea. Call your doctor if you see the stool is consistently watery.
Diarrhea is a concern because infants are so small that it doesn't take a child very long to get dehydrated. An adult can withstand, say, vomiting and diarrhea losses much more easily than a child can. So if a child is continuing to have diarrhea, particularly if it's associated with vomiting, that's a red flag, definitely in the newborn period.
Dehydration. If your baby has less than 4 wet diapers in a 24-hour period, contact your doctor. Upper respiratory infections. If your baby has a cold that makes it hard to breathe or eat, or if your baby also has severe coughing or discolored phlegm, use nasal saline drops until you can visit the doctor.
Babies will oftentimes sneeze in the newborn period, and people misinterpret that as the sign of an early cold or maybe allergies. Well, that is just the baby trying to keep his nasal passages clear.
Ear pain. If your baby pulls at one or both ears, has drainage from either ear, or fails to respond to loud sounds. Rash. If a diaper rash or patch of eczema becomes red and raw, or if your baby suddenly develops an unexplained rash along with a fever. Eye discharge. If one or both eyes are pink, red, swollen, or leaking a sticky fluid. Of course, Don't hesitate to seek emergency care for bleeding that can't be stopped, poisoning, seizures, trouble breathing, high fever, head injuries, sudden lethargy or inability to move, choking and unresponsiveness. Remember, whether you call your baby's doctor or go to the emergency room, be prepared to answer any questions. Stay calm so you can explain what's happening to your baby. They'll need to know your baby's symptoms and medical history, changes in your baby's feeding and bowel movements, changes in your baby's temperament. What is your baby's fever? And have you given your baby medication? If so, how much and when? By anticipating these questions and knowing the answers, your doctor or medical staff will be able to better determine what's wrong with your baby. If you think you need to call or see the doctor or go to the emergency room, do it. It's better to be safe than sorry. For more information on when to call the pediatrician, visit our website at www.forbaby.com and click on Checklists.